This topic is going to be very important to us, which it is elderly and mental illness. Why is so important? Stick around.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good morning, good afternoon, good evening. I am Andrea Albertini, the host of this podcast, Senior Care Made Simple, and I am here today with my co-host, Doris Muscarella. Good morning, good afternoon, good evening, Doris.
Hello, everyone. Happy to be here.
And we have an amazing special guest. So we are here today with Alexia. And so please tell us a little bit about yourself.
Okay, great. I'm so happy to be here, Andrea. Thank you for inviting me. So again, my name is Alexia Ianides. I'm a licensed psychotherapist. My credentials are LMHC in Florida. I'm also a licensed professional counselor in Colorado. I'm also a qualified supervisor in the state of Florida. I'm also a registered dance movement therapist. So I'm very passionate about different modalities of therapy. And I'm here to talk about elderly and mental health and why it matters.
It's a topic that is not talked about as much as we should. And by the way, you had me at the dance therapy, so we're going to get into that later.
Great.
But let's talk about the elders.
By 2030, 1 in 5 Americans are going to be over the age of 65. And in general, there's a lot of stigma when it comes to mental health and mental illness, but even more so with the elderly. The older generation happens to be a stoic generation. The baby boomer generation is known as the greatest generation ever. But they were also very silent. They didn't talk about their feelings. They didn't talk about what they were struggling with because they were dealing with so many issues at that time. World wars, the women had to stay home and work while the men were fighting abroad. So they weren't really talking about their mental health, their emotional health. And now as they're aging, oftentimes mental illness is underdiagnosed and it's confused with old age when really they are struggling with depression, with anxiety, with trauma, but it's being brushed aside as old age. And that's not okay.
No, it's not okay. And actually, as you know, I own a home health agency in Palm Beach County in Florida. And one of the things that we have added was counseling. It was therapy for our clients. Mm-hmm. We are very, very in tune of what's going on because my company is run by nurses. Mm-hmm. So we are able to detect there's depression or there's some kind of mental illness or addiction, mm-hmm. Because sometimes they become addicted.
Right.
On either pills or alcohol because of the depression, because they're not able to cope.
Mm-hmm. That makes a lot of sense. Yeah, I'm so glad to hear that there's screening at your agency to detect mental illness and behavioral health problems in the aging population.
What are the most common mental health issues do you see? Tell me the first 5.
Sure. Well, I see mostly depression and anxiety. So oftentimes in the elderly population, depression is misunderstood or misdiagnosed as dementia. Yes, you see a lot of dementia in the elderly population, but depression is also very, very common. You also see anxiety, health concerns, right? Chronic illness, pain. This can cause anxiety for the elderly population. Also, the loss of purpose.
Right, that's a lot. That's a big one.
It's a big one. There's different lifespans and there's different tasks across those different lifespans. And the task for the elderly population above 65 is generativity versus stagnation. So the elderly population above 65, they need to feel like they're generating purpose, they're generating community, they're generating love. And if they don't feel like they have purpose, they fall into depression, they fall into anxiety. Again, we see chronic illness, we see chronic pain, we see medication side effects that all also can cause anxiety amongst the elderly population. Substance misuse. We see that with dealing with chronic pain. We see that with medication and prescription abuse as well. So I would say those are the top 3 that I often see. You also see mood changes, obviously, with dementia. That's very common with the elderly. But I would say those are the most common that I see.
Very interesting. What are the barriers to treatment?
Stigma, like I mentioned before. Sometimes, again, that population tends to sort of be underwhelmed by their mental illness. Oh, it's just old age. I'm not crazy. It's just old age. So as a society, we have to be able to recognize that when we hear the elderly saying that, we have to dig a little bit deeper and screen better to see, is this just old age or is it really mental illness? Another barrier to treatment would be mobility. A lot of elderly, obviously, you lose their mobility as they get older. They're not able to transport themselves. They're not able to drive. Finances, cost of therapy as well. Some of them have insurance, some of them don't. Yes, some of them have Medicaid, Medicare, but also, and I'm being honest, a lot of therapists that accept Medicaid and Medicare, they're not the greatest quality therapists. I don't accept insurance. I do everything out of pocket. And you'll see that a lot in my field where a lot of therapists do not accept insurance because of the barriers and the issues that we deal with insurance companies. So that's a whole other subject that we can discuss as well.
Let me ask you, in here, you didn't mention the big C, the cancer.
Mm-hmm.
When you have a patient that is dealing with cancer, do you also treat that person? Do you evaluate them? How do you proceed with a patient that is undergoing chemotherapy?
Yeah, I actually have a client on my caseload who I've been seeing for the last 5 years who has cancer diagnosis. He's in remission currently. We don't treat the medical aspect of the illness, but we treat the emotional aspect of the illness. So he came to me because he needed somebody to talk to. And he talked about the stigma of being, a business individual, a CEO, and feeling vulnerable about this illness, this diagnosis. So again, we talk about more of the emotional and the mental aspect of the cancer, not so much the physical aspect, if that makes any sense.
Yes, absolutely.
And I think one of the things that is happening, like you said, the baby boomers, right? We're busy raising kids and we're working and, we can't get a breather. And especially I think women, we don't have time to think about our problems or some certain things that we went through in our life. There was a big change psychologically with us. But you also have a lot of people, again, going back to the stigma, is I feel that a lot of males are worse than women. And that, I think that's why there's so many divorces out there right now, because they don't want to talk about it. I know someone very close to me that, that's what happened. Is like you just sweep everything under the rug and you think it is going to go away. And, and we need to be able to verbally express. And it's not what you say, it's how you say it. This, I'm not comfortable with this, or I don't like this, or this how it makes me feel. And I think that we lack that.
Absolutely. I love what you're saying, Andrea, because you're dealing with the root cause, and that the root cause is the system. There's a failure in the system. The system benefits off of people being sick, not so much preventing illness. Okay. And even what you said about males not really seeking therapy and males not really being able to express themselves and talk about their issues, it's because they're told culturally, especially in the West, that if they talk about their issues, there's weakness. Right? They can't show vulnerability. If they talk about what's really bothering them or what's going on in their marriage, they're weak. They're not strong men. And so that's a barrier to treatment for men in general, let alone the boomer generation. Again, they were all fighting world wars. The last thing they're thinking about is their depression or their anxiety. They were in fight or flight, trying to survive. So men are much more likely to have depression, especially white males, honestly. The suicidality rate in white males is the highest amongst any population, believe it or not. And it's because they're not, and it has nothing to do with them being white or not, but males in general, they're not encouraged to seek counseling. I think that's beginning to change ever since COVID 2020. Therapy became sort of cool again. It's in vogue to seek counseling, but we have a long way to go for sure.
So September was Suicide Prevention Month. What can you tell us about what warning signs, what do we need to look for our family or for even ourselves?
Yeah, that's a great question. So some risk factors and what to look for, I would say, is isolation. When individuals in general, not just the elderly, begin to isolate, that's a huge red flag that they're falling into depression and can lead to suicidality or suicide ideation, which basically means they're having suicidal thoughts. It doesn't necessarily mean that they have intent to follow through with it or a plan or means, but that's how it begins. And so it's really important to identify, is there suicidal ideation? Are there thoughts regarding suicidality? Isolation's a big one. Also, we see chronic illness. If someone's in a lot of pain, that can cause someone to have suicidal thoughts as well. Mm-hmm. And that's very common with the elderly population.
Oh, absolutely.
Chronic illness, chronic pain, loss of their spouse, loss of their loved ones, loss of their friends. When they start to see that everyone around them that they've known for so many years is passing away, this again can cause a lot of grief. They don't know how to cope with it. And so the suicidal ideation can surface as well. And then again, like I said before, loss of purpose, loss of role. If they were used to being mom, for so many years and they deemed a lot of identity from that, or wife, and now their husband's passed away, a huge part of their identity is gone. And so it's about reinventing themselves and finding that purpose. So once we start to see these risk factors, we can naturally assume that they may be having some suicidal ideation. And the way to counter that is by screening.
Right.
Not just at the primary care physician, but the community centers, even their caregivers, screening them, asking them certain questions about these risk factors, letting them know. Even a great question that I ask my clients is, tell me from 0 to 10, what's your pain level right now? Or what's your motivation level to live? Or, how depressed are you from 0 to 10? That kind of gauges how serious their symptoms are. If they're at a 4, okay, it's a little bit more manageable. But if it's at a 9 or a 10, this is an emergency. This requires an intervention at this point. So that's just a simple way to gauge if someone is, in an emergency mode.
Well, I had a friend a couple of weeks ago that it called me hysterical crying. So I called the husband immediately. And I said, you need to get her into psych now. Mm-hmm. She was suicidal. Mm-hmm. But at least she was verbal enough. She just said, I don't want to live anymore. I don't have any reason to live anymore. Mm-hmm. She didn't say she was going to kill herself, but I freaked out. Mm-hmm. So I immediately then called the husband and I said, you need to get her in the car and you need her to take to psych. Mm-hmm. And maybe they need to adjust her medication. She needs some counseling and everything. So I think that a lot of times family says, oh, I don't want my loved ones on that environment.
Right.
Well, I'm sorry, but that's the environment your loved one needs to be.
Right.
Because at that point, they're not even thinking that they are in that place.
Right.
They are over there to adjust medication, counseling, and to make them feel better. And I think families are the worst.
Yeah. But they need to be regulated. They need to be put in a place like that so they can recalibrate and re-regulate.
100%.
That's important.
Mm-hmm.
No, absolutely. But I also think that, family needs to be more aware and be more aggressive.
You're 100% correct. Caregivers need support as well. So a lot of these caregivers are overwhelmed. They're stressed out. They're dealing with perhaps, 2 parents who are dealing with chronic pain, chronic illness, and they don't have the education or the support as well. So it's very important that we provide psychoeducation for the caregivers so that, like you said, Andrea, they're coming out of denial and they understand how serious this situation is. Like, you're such a good friend that you created an intervention for your friend and said they need to be taken to the hospital right away. They need to be stabilized regarding this crisis.
Right. Well, I was a caregiver for my husband passed away a little year and a half ago.
I'm sorry.
Thank you. And I was a caregiver for my husband. I know what that is. I did seek counseling. Mm-hmm. So actually I was talking to a therapist twice a week.
Good.
Because I was dealing with something that I couldn't control.
Mm-hmm. Stressful. It's very stressful.
Very stressful. He was the love of my life. He was my soulmate. And, and here I am in healthcare myself. Mm-hmm. And so that was a battle for me. So I can't imagine, some of the people out there that don't have the knowledge or the support that I had.
Thank you for sharing that as well, because I think a lot of people need to hear the vulnerable aspect of practitioners, and your story resonates a lot with me as well. Just to keep it personal, my mother's a caregiver to my father. My father has kidney disease and he gets dialysis 3 times a week. And I tell her, I said, Mom, she sees a counselor because she needs someone to talk to. And I tell her, do things for yourself, take time for yourself. have hobbies, go out with your friends, because you need to pour into yourself as well. Yes, you're pouring into my father, but if you don't pour into yourself, you're going to burn out. So I agree 100%. It's just as important for the caregivers to have support as it is for the person who's being given the care.
And another thing that I wanted to mention, is the insurance companies. Again, a lot of therapists such as yourself, psychologists, doesn't take insurance anymore because they don't want to pay. They take forever to reimburse you guys for your services. And again, I think this is a stigma, again, from our society. And again, it's not just this country, it's all over the world. There's no money that is being poured into psych, to mental health. There's no money in that.
It's so sad. And again, you're going back to the root of the problem, which is the system. The system is designed to keep people sick. And this is, again, just working in the field for 20 years. This is what I've seen. This is what I've experienced. I've worked in treatment centers for so many years. The insurance companies won't pay for a client to go back to therapy or back to treatment, but they'll pay when they relapse. When the person's relapsing, when the person's on their deathbed, they'll pay for them to go back into treatment. But if a client's saying, I'm struggling, I need support, I need a higher level of care, they won't pay for it. So they wait till the client relapses, which means they can overdose and die. But they won't pay when the client's saying, hey, insurance company, I have the benefits. I want to go back to intensive outpatient or partial hospitalization. Nope. They have to relapse. And I know clients who have purposefully relapsed so that they can get back into treatment, and they're put back at inpatient and residential. That's terrible.
It is terrible.
Yeah. There is a movie on Netflix called Adolescence. I don't know if you've seen it.
I haven't.
A 13-year-old kills a schoolmate. And the child had flags. He was schizophrenic. And the parents, like you said, were in denial. That is the biggest problem we have.
Yes.
We don't want to accept the fact that we might have an issue with a parent or a loved one. And it wasn't until he killed somebody that, and went to jail that the parents said, we knew he had a problem. We knew he had outbursts, and we did nothing about it.
Right. Right.
But you know what I also think, from my own experience with my daughter has bipolar, I saw that there was something, but I didn't know what it was. And the interesting thing is that how the schools never picked it up.
They're not trained to pick it up either. They're not trained. And that's why we need more counselors. We need more licensed therapists in school systems, not just school counselors. School counselors deal with bullying and some mental health, some behavioral health, but it's more so, let me help you adjust to this grade. Let me help you adjust to this life transition. You just moved from another city. They're not trained like licensed psychotherapists or psychologists to be able to identify suicidality and more severe mental illness. I think they're getting there, but they're not there yet.
Right, which I think is so important, starting from the beginning. From the first time that your child goes into school.
Yeah, so, my message for families and caregivers would be, involve your loved ones who are elderly, ask them how they're feeling, use that 0 to 10 scale to gauge their symptoms, involve their primary care physician, other providers that they're working with, have interdisciplinary team meetings on Zoom or phone or in person. It takes 15, 20 minutes to discuss issues that might save someone's life. Okay. And it also helps the caregiver as well. I think it's important to preserve dignity for the elderly person by involving them in the conversation, to let them know that their voice matters as well. And again, going back to the theme of caregivers also needing support. And Andrea, I think you touched upon something very important. These skills, these tools, psychoeducation, it needs to be taught from youth. It needs to be taught in the education system.
Exactly.
Okay?
Exactly.
Goes back to being preventative minded as opposed to they're sick already and now they need treatment. It's costing billions of dollars to our society.
Right. Which, it would have been so much cheaper and easier for us to be able to start from the beginning. Yeah, absolutely.
Okay, so when you started to give us your credentials, you talked about therapy with dance, and I love dancing. So can you give me more information about that so I could sign up?
Sure. So I was a psychology major in university and I was a dance minor. Dancing is my number one passion. And I always thought it would be awesome to integrate my love for dance with my love for counseling. And lo and behold, I found out that there was an actual master's level field called dance movement therapy. You might have heard of art therapy, drama therapy, music therapy. And so there is a real field called dance movement therapy. And I decided to pursue higher education after I became licensed as a psychotherapist, traditional talk therapist. I got into dance movement therapy as well. After I became a registered dance movement therapist, I started working in different treatment centers offering dance movement therapy groups to a range of populations. And we believe as dance movement therapists that changes in the body reflect changes in the mind. So when we move our bodies in certain ways and we use our body and movement to express our emotions, we'll see those changes in our mind as well reflected. Whereas traditional talk therapy, we're having changes in our cognition, but we're sort of dissociated neck down. We're not engaging our bodies. Dance movement therapy is called bottom-up healing. We're moving, we're expressing our emotions through our movement, and then we process and talk out what we felt in our bodies and what memories came up and what thoughts came up as we were moving. So we're really engaging the total being, mind, body, and spirit, as opposed to just talking to someone and disengaging from the body, which isn't healthy.
Well, that's awesome because actually, I used to dance as well from the time I was 10 to the time I was 14. And absolutely love it. I did ballet and all that. So 2 months ago, I just enrolled myself at Fred Astaire. And I dance twice a week.
Therapy.
And eventually I'm going to do it 3 times a week. It was the best thing I could have done. I don't like the gym. I don't like to work out. Never did. I did it because I had to. But this has been absolutely amazing for my mind. Starting my day on Monday, and I'm doing tango. Can you believe that? Argentinian tango. And I love it.
Hilarious.
And so this has been absolutely, even though it's not what you do in terms of the moving therapy, I'm just dancing. And it's really making me feel like $1 million, really. And I told my trainer, I said, in a couple of weeks, I'm going to be away for a little bit. So in a couple of weeks, I want to do it at least 3 times a week. I'm so excited. So now question, do you have a studio for people to go?
I don't actually. So I've had a private practice for the past 12, 13 years. And I would see my clients individually at private practice and do talk therapy. But then as an independent contractor, I would go to different treatment centers and offer dance movement therapy services. I do not currently have a studio. I only see clients remotely, and I do dance movement therapy remotely as well, telehealth. A lot of people ask me, how can you do that? You have to be in person. You don't have to be in person, actually. I think telehealth gives a lot more access to mental health services to individuals who live in remote locations and maybe don't feel comfortable leaving their home. And so I offer dance movement therapy via telehealth as well.
Oh, that's awesome.
Great. That's
awesome. So if any of you are interested in talking to Alexia, all her information will be down in the show notes, and any of you in the country would be able to connect with her. I think this is really exciting. I'm gonna schedule a session with you. That's for sure. Well, I want to see what you do. Because I think that we can even probably use with some of our clients. This is amazing. Please email us at seniorcaremadesimplepodcast@gmail.com. seniorcaremadesimplepodcast@gmail.com. Thank you, Alexia, for coming today. We really enjoyed our show.
Thank you for having me. It was a privilege to be here.
And thank you again, Doris, my
Absolutely.
favorite co-host in the world.
Thank you.
And I'll see you next time, everybody. Thanks for joining us today.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.